first I would like to ask for your permission to use this video for educational purpose and on internet.
Yeah, that's fine.
Thank you. Now tell me, what were your symptoms before the surgery?
Well, just very bad pain.
For how long?
Well, it started, slow, like maybe 5-6 years ago, and then it just got worse and worse. And before the surgery, it was, 8, 9, 10 all the time.
Okay.
I tried the shots.
And tried every other things, but we decided to do a minimal invasive surgery, the OLLIF procedure, and we did it about 11 months ago. How long did you stay in the hospital?
I stayed overnight
Okay.
and went home, and my kids thought they should stay, but nobody had to stay.
So you were okay? You could
I did
go about your...
everything. I mean, I didn't reach down to my laundry like I used to. I had it
Yeah.
fixed up so I could,
But
but
right
I did
after
everything.
Excellent. How are you now? How is the pain that you
I
had before the
have
surgery?
no pain. I have some discomforts at times, maybe that stop me from doing something that I shouldn't do.
Yeah, like bending,
But-
twisting, lifting?
I don't twist. I really try, and I try not to lift anything too heavy.
Okay.
But I mean, I even mow my yard. But
So you're back to your previous life, and you said that you're able to do almost everything.
yes, compared to a friend who had her back cut open all the way.
No, tell me about it. You told me that story. Tell me, what was the story there?
She told me before I had the surgery how it was going to be and
What
how
did
long.
She had the open surgery. Okay.
Yes, she had the
What
open.
did she tell you?
She just told me how I was going to not be doing much for quite a long time.
Okay.
And they were all amazed at how I was walking and what I was doing right away.
Yeah.
And I said, well, I don't have pain. And I can't remember, I forgot about the pain pills, but I would take them some.
If needed, yeah. But that's a
Yeah.
good thing that you forgot to take pain medication
Yeah.
because
I
meaning
didn't
that
need it.
you didn't need it. And as well, we actually made a science out of it. Whereas 95% of our patients ambulate within 24 hours, only a small percentages, 2 to 3%, ambulate after open surgery in the first few days. So we even made a science of it. So what you're reflecting that you went home and you start just living your life,
I did.
that is reflective for this kind of surgery. I'm going to swing here and show that we did a 1-level OLLIF for you, and you had a spondylolisthesis. We did a 1-level fusion. Everything seems to be in a good position, and the healing is ongoing. But it seems that actually bone is healing in this area. In the back, bones start to heal, but we're still going to have to wait and let it heal a little longer. But overall, happy with the results so far?
Oh my, it's wonderful.
Okay, thank you so much. I appreciate that.